Hey, everybody, welcome. Welcome to a conversation on Age of Becoming. I'm Susan McCulley, and I am delighted to be here today with Beth Riddle, who is a friend and a Nourishing Movement participant. Um, and she and I had the most interesting conversation a couple of weeks ago, and I wanted to share that with you. But welcome, Beth. Thank you so much for taking some time today.
Thanks for having me, Susan.
Yeah, it's great. Um, so as some of you may know, I worked for 20 years at a local health club, and every year I got CPR training. And as part of the CPR training, we learned what the signs and symptoms of a stroke were. Beth, you have a nursing background. So so before your experience,
Mhm.
tell me what you would have thought signs and symptoms of stroke were.
Well, from what I had learned, it used to be the acronym FAST, F-A-S-T. F stood for face, A for arm, S for speech, and T for time. So your face was usually droopy on one side. Your arm usually was very weak, or you couldn't move one side of your arm. Your speech, for S, speech was difficult to understand. You couldn't get your words out, or maybe you were dribbling saliva. And T was time, the importance of time to notice it and get in to the hospital. I didn't even know they changed it over the last few years to B fast. They added balance for B and eyes for E. So that was my understanding. It was pretty graphic when someone was having a stroke. You'd ask them to smile, and you could tell there was an imbalance, or you would ask them to squinch up their eyes, or you would ask them to repeat something. It was very obvious when
Right,
someone was,
lift your arms.
yeah, yeah.
Yeah,
Strength, you could, one arm would be very weak. You would have, um, so speech, time wasn't a part of, time is important and part of it, but you can't assess that. The time wasn't something you assessed. So that was my understanding. That's what I was taught. That's not what I experienced.
yeah. So tell us what your experience was.
Okay, this happened back in May, just recently. I woke up in the morning, I was fine. That on a Wednesday, it was a Wednesday morning around 10. I noticed on my right hand, I had some tingling on my ring finger and my pinky, just a little numbness, enough to, I kept playing with it. Like it just felt different. And then as the day progressed, it moved down to my hand. And you know how when your hand's asleep, like you slept on it wrong, but it was persistent. But I was able to garden. I was able to play with my puppy. I was able to, make lunch, the usual things. But as the day progressed, it progressed down to my elbow. Didn't hurt, wasn't painful. Everything else was fine on me. But the numbness just went down to my elbow, and the tingling. And I thought, darn, I'm having what my husband had. He had the same symptoms. He had something called ulnar entrapment syndrome, which is your funny bone nerve gets caught up and it gets all, and he had to have surgery for it. And I even asked him, I said, Jim, what were your symptoms? Same thing, these two fingers moving all down. And I thought, darn, what's the chances I'm going to have the same surgery as you? Didn't think anything of it, except that that's what was going on. So that evening, went to bed, same thing. It just stopped at my elbow. And I was still having the whole feeling. That night, I was very restless in bed. This might sound strange to some people, but my mother came to me in my dreams or in my thoughts, or maybe when I was awake. My mom's been gone for 22 years. And I just thought, and I don't dream about her much, but I thought, this is just, I was just restless. When I woke up in the morning, my whole right side of my face was completely numb. You could look at me and I was fine. Didn't look any different, but it was as if someone took Novocaine all under my skin, like you get at the dentist, and your face gets puffy. You feel it. It's not puffy to the person looking at you, but that's how it felt. Puffy, the whole, and from my forehead all the way down to my lower jaw, just totally puffy. Wasn't painful. Nothing was painful. And the arm thing still, was the same, just to my elbow still. But at that point, I knew I was having a stroke. I thought I was having a stroke. I thought we need to get in. So we went to the ER. And
So because when it had progressed,
yes,
and the sensation in your face, even though you didn't have the droopiness,
yeah,
that was enough for you to
yeah,
say, we gotta have this
you have to
checked out.
go. I remember going and telling my husband, because I looked fine. You couldn't see anything on me. I could feel it, but nobody could see it. And I thought, it did occur to me that, oh God, they're not going to believe me, or this is going to be dumb, or, all those feelings that you have of, you know, first of all, waiting. And it was too late to do any kind of medication, which I know that's what the T is for time. You usually have about 3 hours to get the injection if you're having a stroke, to break up the clot and make it's not always a good thing to have, but sometimes it's recommended. I knew the time was past.
Right.
But I also didn't know what else is going to happen. It might keep snowballing. So we went in, and kind of made me mad. I have to say the hospital was great. Everybody was wonderful. The only thing, when I first got there, the triage nurse, she said, okay, we're going to admit you. And she said, what took you so long?
Mm.
What took you so long? And I told her I thought I was having the, entrapment syndrome. And that's what took me so long. But I thought that, dang,
Come
But
on,
anyway,
cut
so
me some slack, please.
they took me back right away, which was good, which is a good thing.
Great. And what did they tell you?
Well, first they, you normal stuff, EKG, all that kind of stuff. Then oh, sorry, I was distracted with the dog, a strange dog outside my door. It's not my dog, it's another dog. They did well, they believed me, even though my hands were strong. They do all the neurological tests. I was equal, everything, even moving my eyes, moving my teeth around, all the neurological tests that they give you physically. They did a CAT scan with contrast, and that it was inconclusive. They did an MRI that was conclusive. It showed 2 spots in the middle part of the back of my brain that had died. So that was confirming that I had a stroke. But I was very lucky. It was in the center of the thalamus region. If it had been a little bit to the left or a little bit to the right, I would have had a lot more damage. But I was very lucky. It was right in the right spot. So they definitely believed me then. Not that they didn't. They just couldn't figure it out. I was not your normal patient. First of all, I was young, not that young, 65, but young, healthy looking. I don't have high blood pressure. I don't have high cholesterol. I don't have diabetes. I'm a good weight. I exercise. I wasn't your classic patient.
Right.
And then they ran a bunch of other tests, echocardiogram. I was there only for about 2 full days, but they ran a ton of tests because the next thing they wanted to know was why.
Well, right.
Why? Because I didn't have a lot of plaque. My CAT scan did not show very much plaque built up in my arteries. A stroke can happen do you want to know how?
I do. I want to know everything.
Stroke can happen usually 3 different ways a stroke can happen. One is clogged arteries into the brain, which is caused usually by plaque breaking off. Like we all have plaque. We all have plaque in our arteries, some a lot more than others. But plaque can break off and it can lodge up into the vessel and stop the blood flow long enough to cause a stroke. You can have a bleed, which obviously if that vessel bleeds for a hemorrhage, you hear about that, that's something you can't control, just happens. That can cause a stroke. And then the other one is vasoconstriction, when the vessel, for some reason, can be they don't know exactly. It could be hormonal, can be a lot of different reasons where that vessel closes down temporarily long enough to impede the blood flow to the brain.
Mhm.
And after a couple months of testing, they think that's what's happened to me.
Mhm.
Um,
Mhm.
or
And
happened to me, but it closed down, then it relaxed again. It caused damage to that area, but you know, the rest of the vessels so far okay.
so, so what are the, all right, so my first question is, how are you feeling now?
I'm
So,
great.
this happened in May. We're talking at the beginning of October,
Yeah.
and you're feeling okay.
Mhm. Yeah.
And and you said that there was some damage done. Is it just, that's just damage? It's like a scar in your brain, or is
Yeah.
that something that bounces back?
No,
Okay.
no. It's luckily small, and that's I always say, okay, that's why I can't find those words. But you know what? I couldn't find those words before my stroke.
I like it though. To have
Now
it in
I
your
have a
back
like,
pocket. Oh,
like, give
it's
me
just
a minute. Give
be
me a
patient.
minute.
Yeah.
So now balance was something that I definitely want to improve on now that with strokes and they came in, even when I was in the hospital, they came in and evaluated my balance, my speech, I mean, they were terrific. I was totally worked up. So balance, I think, even more so now that I've had one, I really work on my balance. Like when I brush my teeth, I move my one arm around, one leg around. See, got to blame it on,
It's a stroke.
yeah, when you lose your words. But no, I'm very lucky. Aside from having to take some medicine,
Yeah.
that I'm not happy about, but I'm being compliant because they put me on a statin, initially a high statin for the first, everything was high for the first 10 days or so because they didn't want me having more,
Sure.
because
Sure.
when you have one, you can have, in that first 2 weeks, your chances of having another one is greater at the first 2 weeks. So
Hmm.
they put me on a high statin at first. Now I'm back down to 20 milligrams, which is a very small dose. And what statins do, even though I don't have high cholesterol, statins help any plaque that might be in your arteries get sticky and kind of lay against the wall. They kind of lay down. It prevents them from breaking off more. So
Hmm.
if that was the reason, which they don't think, but statins are given for stroke victims. They also gave me a blood thinner. I'm
Hmm.
off that though, for 10 days with high blood thinner to keep the blood flowing
Yeah.
quick.
Right.
And I was black and blue up and down because I had a 9-month-old puppy at the time, but I'm good now. And then I am on a baby aspirin for life, which is
Right.
fine.
Yeah.
Just to keep it flowing.
That's not uncommon. And that
Yeah.
was when I worked at the health club. That's what that was part of what, when we suspected a stroke, that was what
Yeah.
we were, not
Yeah.
that we couldn't give them, but we could make one available to them if they wanted to take it.
Perfect.
Um, and yeah, that well, I'm delighted, and well done in the good placement of uh
Yeah.
I'm
I
glad
know.
you worked
Very
that out
lucky.
beautifully.
Very lucky.
So so what I want to say is that you and I had this conversation. It must have been, it was shortly after your experience,
Yeah.
um, and you told me what had happened, and I was just so shocked because I would have said I knew what to look for.
Yeah.
And
Yeah.
within hours of you and me having this conversation, someone who I don't know very well came to me and she said, I feel really weird. I
Mm.
feel numbness in one side of my body. And I did all the tests and I asked her all of the questions and she passed them all.
Yeah.
But I called 911 because of the conversation that you and I had, that
Yeah.
I want to say that I probably wouldn't have sent her in her car if she felt weird like that.
Yeah.
But I was so grateful that you had shared that with me so that when somebody came to me, like I could take them, and not that I wouldn't have taken, but I believed her and I said, and this is not something just to brush off. And so this was why I really wanted to have this conversation and share this information that we can pay attention if we are experiencing anything that feels unusual. And
Yeah.
I really appreciate what you said. Is like the fear around getting to the hospital and looking silly, or
Right.
having them oh, some hysterical
Yeah.
lady,
Oh, what if it's
you know
anxiety? What if it's,
yes, oh
you
my
know,
gosh, I mean all of the
pinched
things. And that
nerve, a pinched nerve from Susan's movement class, or
right. And so thank you so much for your willingness to have the conversation and share your experience.
yeah.
So what what would you like people to know um that um that they may not know? Yeah, what would you say to folks?
Well, when I came out of the hospital that day, May happened to have been Stroke Awareness Month, which I had no idea. But when I left the hospital, I was being discharged, and you walk out of the, because I was on the neuro floor, and you walk out, there's big signs showing the man with one side of his face all, you know, not the same, different. And they had all the symptoms we just talked about that were normal symptoms. I never saw anyone that looked like me, which would have been just a person that just looked fine. And the more I thought about it, even in my I'm being followed by a neurologist now, and now I just go yearly. But even the neurology office, they had the same acronyms, but they had the same pictures of all, the half the body is just different. And I want people to know, if you feel any kind of tingling, numbness, pay attention to it. See what's up with that. Is it something you just slept on wrong, or maybe you have a little pinched nerve somewhere? But pay attention. And if it starts to move and progress, take it serious. Take it serious, because we all get pins and needles in our feet. You sit on the toilet too long, you get pins and needles, or if
Right,
you
right, right.
just sleep with your hand under your pillow, or anything, have your legs crossed too long. But I think women especially have to be their own advocates, because Susan and I were talking about this earlier, is that most studies are done on men. They're not done on women, or they have been done on men. Most cardiac studies and most neurological studies all are done on men. Men's symptoms can be very different from women. So you have to listen to your own intuition, be your own advocate. And it's kind of hard for me to say that, because I am the type of person that will wait too long. It's like I can deal with the pain, I can deal with this. But
Hmm.
after going through that, I really think, and say it's not a stroke, you'll be lucky if it's not a stroke. And you go in there and they do all the workup and it's something else. Then it's something else. But you, at least you got in there and you ruled out something that was more serious.
Right.
So I think you have to really, really push for it. You
Yeah.
know,
Yeah. And part of what we do in the practice that we do together is noticing, right? Noticing
yes,
changes, noticing, right. So yes, when we get pins and needles, when I've been sitting at my computer too long, or you sitting in the car funny or whatever, but
yeah,
then when I move, it starts to dissipate. But
yeah,
as you say, if it starts to move, like spread in your body, if the sensation intensifies in some way, as it did when you woke up, these are the things that we really want to be sure that we pay attention to.
right.
And I think that yeah, and having the confidence or the courage to say, I want to go and have this checked out.
Yeah,
And that's fantastic if it's not anything
absolutely.
serious.
And listen to your subconscious also. I think the fact that that I wasn't sleeping well that night, and then I felt like my mother was talking to me like she
Mm.
died young, and it's like, well, listen.
Huh.
I felt her saying, listen to your what you're thinking, and pay attention. So yeah, just
Yeah.
is
Yeah.
interesting.
That is so helpful, and I really am grateful for your willingness to share. Anything else that you would say to folks listening about this
Well,
experience or anything else?
of course, I can get on the bandwagon of healthy eating and exercise and reduce your stress through breathing and walking outside, meditation, petting a dog, being nice to someone, smiling, whatever. All of those play a factor. I mean, you can be the healthiest person still, not that I am, but you can be the healthiest person and still have problems. But I think the more healthy you are, the better chances you're going to come out of it on the other side. And everybody has told me that for
Yes.
many things that have happened to me over the last 20 years. I've had other health issues, and they said if you weren't as healthy as you were, we probably wouldn't be having this conversation, or it would have been your outcome would have come a little bit different. It would have turned
Right.
out. So I
Right.
think eat healthy, exercise, reduce your stress, get sleep, all the things that we know. We all hear about it, but it is important. It is
Right.
important.
And I would say that as a movement instructor, I would say that this is true for like injury too.
Mhm.
That if like the stronger you are, the better your balance is, and as you mentioned, and actually I have a whole course in balance that I created a couple of years ago that I will link to this
Uh,
to share with folks because that is absolutely something that you can improve
yeah,
no matter how old you are and no matter what
right.
your condition is. It's a great thing to work on, but
Yeah,
the better your foundation of health and wellness, the better you will bounce from anything from a sprained ankle to a broken bone to surgery that you have to have, whatever it is.
yeah,
That you're starting from a stronger place and will make the experience as good as it can be. So I think that's wise counsel. Wise
yeah,
counsel.
yeah.
Beth, thank you so much, and I am so grateful for you,
Thank
and
you.
may your healing continue.
Yeah, thank you.
All right,
Appreciate
thanks so much.
it.